it can feel really overwhelming trying to find the right type of therapy, but it doesn't have to be. And it's important to kind of do a little research to know what kind of therapy is right for you.
Nowadays, therapy options almost sounds like acronym soup. So what is EMDR and what is DBT and what is IVS? And my goodness, what does all that stuff mean? We are joined by a psychotherapist who actually specializes in the treatment of trauma, depression, anxiety, and more. And she's going to help walk through psychotherapy soup. I would like to say hello and welcome to Stella Kimbrough. Stella is a licensed clinical social worker. And Stella, you are in Philadelphia. And I know you specialize, one of the things you specialize in is the treatment of trauma. Let's talk a little bit about these various approaches. Can you give me a brief explanation of what trauma is? And then I'd like to talk about some of the acronyms that I've thrown to the audience.
Absolutely. Well, first of all, thank you so much for having me. It's truly an honor, Dr. Brewer, to be here with you today. And I'm super excited to have this conversation with you. So trauma, it's a good question. It's a phrase that's being thrown around a lot these days. Trauma really is in the eye of the beholder. Trauma affects everyone differently, right? From a zoomed out sense, trauma means something that happens to you that's too much, too soon, too fast. It's something that overwhelms your nervous system. It can look like different things for different people. There's big T trauma, which could be something really severe, so like abuse, sexual assault, going to war, experiencing a natural disaster, a mass shooting, something like that would be like big T trauma. And then there's little T trauma, which could be not less significant per se, but perhaps more accumulative over someone's life. So could be things like bullying. It could be just not getting your needs met growing up. It could be something that's maybe not quite as intense as big T trauma, but still has an impact on you.
Okay. That's a great, I think, explanation. And so many times people will say, well, that wasn't traumatizing for me. And so part of what you just said that was really important is really, it's kind of in the eye of the beholder. It's how you experience whatever the issue is. So let's talk about EMDR. What on earth is EMDR?
That's a good question, and I like you're talking about all this alphabet soup. Therapists apparently love acronyms and letters. So EMDR stands for eye movement desensitization and reprocessing. It's a type of therapy, and I guess just to zoom out a little bit, the three types of therapy I'm going to talk about today are very different from traditional talk therapy. So we think of therapy as we come in, we talk with a therapist about our problems, what's bothering us, then we maybe get some solutions, and then apply that in our lives. So EMDR, DBT, and IFS are different. They're very structured very differently than traditional talk therapy. And talk therapy is what most therapists do, but some therapists have specialized training. So EMDR, it was designed specifically to treat trauma and PTSD. It was created by a psychologist named Dr. Francine Shapiro in the 1980s. What it is it helps us desensitize from traumatic memories using rapid eye movements. So a little brief history. So Dr. Shapiro was on a walk and she was thinking about something disturbing that happened to her. And she noticed that her thoughts were going back and forth on this walk. And she noticed afterwards that, wow, she felt better. She noticed that these memories and images that she was thinking about no longer held the same intensity. And so that led her to later develop EMDR, which incorporates rapid eye movements into processing. So yeah, just a brief overview. Yeah.
And you use the another piece of soup, PTSD, post-traumatic stress disorder, just so folks know what
Yeah.
we're talking about. Okay,
Thank you.
it's okay. We're
Yeah.
therapists now. That's what we do. Talk to us about DBT. What is that?
Sure. DBT stands for Dialectical Behavioral Therapy. And it's a much more solution focused, concrete, skills based therapy. And it was also created in the 1980s by Dr. Marshall Linehan, who was trained in cognitive behavioral therapy, or CBT, which is another alphabet soup type of therapy. But it's again much more skills based. Usually there is a group component, so it's almost like taking a class where you come in every week and you learn skills, and then you meet with your individual therapist and you talk about your skills use, and you track how many skills you're using, you track your mood, your symptoms, and how you're applying the skills and kind of problem solving around that. It's based in again, cognitive behavioral therapy, which is the idea of changing our thoughts in order to change our emotions and behaviors. So we're doing a lot of emotion regulation skills, a lot of trying to change the way that we're thinking, changing our emotions. There's 4 different types of DBT skills. So there's emotion regulation skills, there's interpersonal skills, kind of like relationship skills. There's distress tolerance skills, so how to navigate an intense situation without things getting worse. And then there's mindfulness skills. And all of the DBT skills are grounded in mindfulness, and DBT was all of the skills are grounded in principles from Zen Buddhism. The founder, Marshall Linehan, had a lot of experience in Buddhist monks with Buddhist monasteries, and she incorporated those teachings into her therapy.
Gotcha. Folks, I'm just going to turn away from Stella for a second, and I'm going to guess that you have already learned some things that you didn't quite know about before, which is really why M.E.S.H exists. So I invite you to follow, subscribe, and share M.E.S.H with someone you care about. Let's go back to our conversation with Stella. Stella, let's now talk about IFS. There's so much soup that us therapists come up with. It's amazing. Let's talk about IFS. What does that mean?
It's so amazing. You're right. So IFS stands for Internal Family Systems, and again, created in the 1980s by someone named Dr. Richard Schwartz. He's a licensed marriage and family therapist. And as a family therapist, he was noticing some of his clients talking about parts of self, that they use this language of, oh, there's a part of me that feels one way, but then there's another part of me that feels this other way. And so he had the idea to kind of almost do like family therapy with someone's individual parts of self. And this is not to say that he's not saying that everyone has multiple personalities. It's not like that. It's saying that everyone has multiple parts of themselves that come out at different points, and they have their own qualities to them. So, for example, you could have a inner critic, right? How many of us have inner critics? Like, so many of us. Or it could be a part that is constantly managing things in your life, or like an addictive part, turning to kind of addictive behaviors, right? There can be so many different aspects to what makes us whole, right? And at the core, we have ourself. And so IFS is about kind of first of all, getting to know identifying what the parts are that we're working with, and being with all of our parts in a way that's more cohesive. So if we have a part that's causing us a lot of problems, that we don't want to like kick that part away and be like, no, get out of here, because that's not possible, right?
Right.
It's more about like, let's be with the part, get to know it, see what it's doing for us, and try to create some harmony within our system, and be with a part in a way that feels more useful for ourselves.
One of the things that I appreciate about your description is that you're making it very clear. This is not about somebody who has different personality states, which is really certainly something that happens. It's complicated in a different way. None of this is about who's crazy and who's not, which a lot of times people say, I'm not crazy and I don't need therapy. And, that's a whole other conversation because none of this is about that. All of
Yes.
this is about how we live as human beings and the different ways in which our lives lead us and we lead our lives. So let me ask you this. You've talked about EMDR, DBT, you mentioned CBT, and we just talked about that's okay. And we just talked about IFS.
Mhm.
How do you decide what is the most appropriate person to use this particular approach with, whatever that approach is?
Yes. Oh, that's such a good question. Yeah, and so I guess I'll come back to something that I touched on before, which is that most people, when they're coming into therapy, they're seeking out something different. They're seeking out talk therapy, right? Coming in and talking about, and it's not structured like this. So someone who might be a candidate for one of these three types of therapy could be someone who has done talk therapy before, and maybe they haven't seen the changes in their lives that they were hoping to see. Maybe they're still really suffering from the symptoms that they originally came in with, and talk therapy hasn't been enough or adequate to address some of their problems and goals. Um, or it could be that you have a specific diagnosis. So DBT was designed specifically to treat people with something called borderline personality disorder, or
Okay.
BPD, and it is the go-to evidence-based treatment for borderline personality disorder. So if you're someone who has this diagnosis, then DBT is going to be the gold standard for you. But we know that DBT is also effective for people who don't have a diagnosis of BPD. Right. So, and I think maybe that's more of what you're asking, of like, how do we know, like, let's say I have anxiety or depression, and so I probably wouldn't, honestly, I wouldn't start with EMDR, DBT, or IFS. If you're new to therapy,
Okay.
I would start with talk therapy, right? So it's sometimes referred to as psychodynamic therapy, and and see how it goes. And if you're noticing that you're needing something more specific, it's your needs aren't getting addressed, that's when I would seek out one of these other things. Or if you know that you have a specific diagnosis that these treatments were designed to treat, that would be another reason to seek them out. So again, with EMDR, it was designed to treat trauma, PTSD, right? If you know that you have PTSD, EMDR might be a great approach for you. IFS wasn't, as far as I understand, it wasn't specifically designed to treat one particular disorder. I know it can be quite effective for eating disorders, addiction, anxiety, depression, and trauma. But it's not one of these like, oh, it's really hitting the nail on the head for this kind of condition. But it can be generally effective.
So clearly what I'm saying, what I'm hearing you say is that one size does not fit all,
Yes.
that the beginning of work really is talk therapy, really is the psychodynamic approach, of which I am a tremendous fan, I confess. Um,
Me
but
too.
but it is a way to really personalize the approach to the person who's sitting in front of you.
Yes.
And that I think is so important, that if for some reason a particular kind of therapy with a particular therapist perhaps wasn't quite the fit for you, Doesn't mean there's something wrong with you. Doesn't even mean that the approach was wrong, so to speak. It means it wasn't a good fit for you. And I think that's so important.
Yes. I agree 100%. Yes. Right. And another on that note, another really, really key takeaway for people is that the most the most important part of therapy is the relationship that you have with your therapist. And that continues to hold up in the research as being the best indicator of a positive outcome in therapy is the relationship you have with your therapist. So to a degree, your therapist could be an EMDR therapist, a psychodynamic therapist, a CBT, and at the end of the day, it's really the connection that you have with the therapist that is the most important key factor. And then also, again, if you have one of these specific concerns that there is a specific evidence-based treatment for, that can absolutely be an important part of treatment.
Stella, you have given us the beginning of lots of great information. I know folks are going to want more and perhaps get in touch with you directly. How do people do that?
Absolutely. So you can get in touch through my website. So it's calmpathway.com. And I'm also on Instagram and LinkedIn. So calm.pathway on Instagram, and LinkedIn, I think is my name, Stella Kimbrough. So yeah, feel free to reach out.
Again, I have to thank you so much for joining us today. You've given us great information, great things to think about, and really expanded perhaps our view of what therapy is, how to think about it, and how important it is to pay attention to the relationship you have with your therapist. Because if that doesn't feel like a good fit, it almost doesn't matter what approach your therapist is using. You've got to feel like you're in a safe space with a safe person. So again, I want to thank you so much for joining us today on this edition of M.E.S.H.
Thank you so much, Dr. Brewer. Really appreciate it.
Absolutely. And folks, I thank you for joining us today on this edition of M.E.S.H. I hope that you know that this podcast grows through listeners like you. You are the reason that M.E.S.H. is here. You are the reason that M.E.S.H. continues to come every week. So I ask you to like, to share, to subscribe, to do the things that you know will help bring these important conversations to people you care about. Thank you again, and I hope to see you next week. You take care. Bye-bye.